The topic that I'm going to be presenting about, the topic whose system we've mapped, and the story today is health and nutrition in regards to diabetes in Ontario. Sexy, I know. We're still working on a better title. But if I'm being honest, the real story we're going to be talking about starts around 5 years ago and with someone who's very dear to me. This is my dad. He's 50 years old, loves black coffee, our cat, and cricket, and still doesn't really like driving on the highway. And in April of 2015, I had to wonder if the previous week was the last time I would ever hear him complain about politics ever again. You see, my dad's been diabetic for as long as I can remember. From childhood to now, I've watched him take pills, inject himself with insulin, and deal with the disease on his own. And for as long as I can remember, I've never really known anything about it. Well, that changed. Diabetes starts in the pancreas. It's when the body is unable to properly produce insulin and manage blood sugar levels. And I also learned that it's affected by a lot of things that you can change and can't really change. Things like unhealthy weight, physical inactivity, and age, ethnicity, and family history of the disease can have a massive impact on what happens. This mismanagement of blood sugar levels can damage blood vessels and nerves. These damaged blood vessels and nerves can have drastic consequences. They can lead to heart attacks and strokes, both of which happened to my father. Now, while he's doing better now, he's not alone. Diabetes in Canada, and in Ontario in particular, is an ongoing battle for over 6 million people. It contributes to 40% of heart attacks, 35% of strokes, 70% of limb amputations, and is the leading current cause of blindness. There are over 4,424,000 people with diabetes or pre-diabetes in Ontario alone. And the diabetes epidemic isn't slowing down. Current conditions have heavy impacts on the economy, environment, and society. As Canadians, we spent $27 billion on it in 2018, and in 2019, $1.5 billion was spent by Ontario alone. The projected cost of diabetes is expected to be $39 billion by 2028. In regards to the environment, plastic used for manufacturing insulin pens and pumps can be harmful as well. Annually, waste from insulin pump therapy is equivalent to daily consumption of coffee in a paper cup. And now, while that may not sound like much, if you consider in Ontario alone there are over 4 million people struggling with the disease today, it adds up. In regards to society, diabetes is hard. It's often associated with significant emotional burdens and can cause various psychological effects such as distress, decreased mood, and disabling levels of anxiety. Our system map contains 11 key stakeholders, and throughout this presentation, we will break down their relationships and roles in regards to the issue. Our two key stakeholders are the government and communities, whose lack of educational resources and social-cultural norms continue to propagate the increasing rate of this disease. The core challenges that these two stakeholders face are a lack of awareness and unhealthy food choices. Education, awareness, and communication are at the forefront of this issue. I mean, going back to myself in 5 years prior, I lived with a diabetic patient for 16 years before beginning to even question what he was going through. And my story isn't alone. If we are blind to the problem so close to home, it causes us to continue in patterns that are detrimental and not conducive to creating a healthier future. What makes these patterns even more significant is, according to both the Government of Canada and Diabetes Canada, around 90% of the people with diabetes have type 2, and type 2 being 9 cases out of 10 preventable. These negative feedback loops are deeply ingrained in our communities, but people have started working towards solutions for them. In regards to the lack of awareness, there are two programs, the Diabetes Prevention Program and Early Detection Program, and they focus on building community initiatives to raise awareness and referral services and early detection for at-risk ethnic populations. Both of these aim to tackle the issue of lack of awareness, and through their efforts, try to bring light to the issue. However, both programs lack in their reach. While they do exist and they are working on making awareness, I didn't know about them, and my father, who's diabetic, didn't know about them until we went out and did the research to find them. In regards to unhealthy food choices, there are food security policies and Canada's new food guide. Currently, 1 in 8 families in Canada struggle to obtain adequate food, and while there's no policy yet, the Canadian government is working on making healthy quality food more affordable and accessible to low-income families. In regards to the food guide, we've shifted our education in terms of the food pyramid and what people should be eating. Emphasis on whole grains and plant-based alternatives and advocacy for mindful eating and frequent home cooking are steps that we can make towards alleviating diabetes in our communities. While there's clearly evidence of the problem and people working on a solution, there still are gaps in the system. The first gap being food security. Food supply is inconsistent, especially for low-income families and minorities. This makes it harder for them to get the quality food they need to support a diet against diabetes. The levers for change in regards to this can be supply chain management, food bank funding, and government assistance in conjunction with a variety of NGOs that work on making food security less of a problem for Canadians. The next gap is the lack of physical activity. According to research done by the Canadian government, physical exercising for 4 hours a week can reduce your chances of getting the disease by over 40%. However, in a recent study, over 72% of people in the workplace stated that they work nearly 10.5 hours a day, leaving little to no room for physical activity. Regardless of size, setting, and type, all work sizes can provide opportunities to promote physical activity for their employees. A healthier workforce, in conjunction, can benefit from reduced direct costs associated with healthcare expenses and other insurance-related things. The third and final gap we identified was the lack of regular screening. Many Ontarians can have prediabetes or diabetes without even knowing. This makes it sort of hard to have a healthy lifestyle to combat the disease if you don't really even know you have it. The levers for change here are the lack of awareness, social stigmas, and family history and doctors. The government implementing policies for getting above 40 years and receiving mandatory testing, as well as modifying it so people who are at higher risk with having cases like their family having diabetes, should be implemented to alleviate some of the pressures in the system. Now, while we did look at the issue from a variety of angles, we do need to do a little bit of self-reflection. Initially going in, we had assumed that there wasn't much research and that's what we needed to solve. We thought that we needed to look at the issue and sort of identify it as an issue, but that wasn't really the case. A lot of people have identified it as an issue. In fact, the World Health Organization calls it, in terms of the general population, a pandemic. The problem is with accessibility. All this information is online, but you have to go look for it. And when people aren't aware that it exists, it causes limitations. Another limitation we had was all of our research was secondary. We didn't conduct any in-person interviews, and with the recent COVID-19 stuff going on, we were never really able to. Also, we chose to focus primarily on Ontario, both because of proximity as well as it limits the amount of factors that we can control and sides to the issue. But despite that, it is a very multifaceted issue with a lot of sides that's affected by politics, and something such as food and personal health is so important to people and cultures, so it gets a little tricky getting into the nitty-gritty. Now, while we did our best to map out the system objectively, statistics and facts can only really tell a part of the story. Behind every diagnosis is a name and a face, a family and a community. Diabetes is a mother waking up multiple times every night to check her preteen's blood sugar for fear of them having a seizure. A father terrified of his kids finding him unconscious due to low blood sugar, an uncle who's wheelchair bound due to preventable amputations. It is a neighbor who must choose between paying rent and purchasing diabetes medication. A teenager who feels anxious and depressed and doesn't know where to turn. And it is also a child who's ostracized at school because she wears an insulin pump. Diabetes is more than just a disease. It is an unfair tragedy that we must work on circumventing together. Thank you.